hug, kiss, and I told him I loved him. And I always did with Colin, I always said, and behave yourself. And he told me he loved me too, and he said, Mom, I'll try. And at 2:39 a.m. Monday morning, his dad phoned me. And he just said, Sandy, it's about Colin. And I'm like, what's wrong? And he just, Colin's gone. Just lost it. It's like somebody took your heart and just ripped it right out of your chest.
Before he left at the door, I remember very clearly saying, I love you, giving him a big hug, and watching him leave out the door. By about 11 o'clock, I had called him. He hadn't called me. There was no answer on his phone. I drove over there. I went to his room, and I found him in his room, leaned up against his bed, and he had passed.
We took Jordy out he was 4 at the time, so we took him out Halloweening. And then the next morning she got a call. I don't know, something about one of the friends that was in that group or whatever. So Lindsay left, and that was the last time I saw her. And then Monday it was after midnight. The police came and that's where she was found. She was found at the drug house.
He said these drugs are killing him. He was at one point he was taking cocaine. He wanted to get better, so he went to Thorpe Recovery Center, and less than 24 hours later, he was dead.
Zachary was 20 years old. He was a very, very bubbly kid, loved camping.
Josh liked his rap music. Josh was a very kind person. He loved his brother and his sisters. He loved going out fishing. He loved going camping and stuff like that.
Lindsay had a sense of humor that was like unbelievable. Family was really, really important to her. Just a sweetheart.
Right from when he was young, he was very charismatic. Anybody that ever met him just thought he was like great. He had the biggest smile. He could light up a room.
Lindsay wasn't a long-time user or anything like that. She started, and then addiction set in, and then that was it. The last 2 months that she was with us, she met these people, and it sort of snowballed or whatever, and she got into meth.
The middle of 2017, we could notice a downhill slide. We found out on October 30th and believed that he had used cocaine twice, but exactly 1 month later he died.
It all kind of started when he was in junior high, kind of got in with the wrong crowd and got into some trouble, so they did ecstasy. Nothing usually heavy though, you know? And then he got hooked on heroin in jail.
It was basically when he was in high school, he just started hanging around with the wrong people, wrong time. He always wanted to he wanted to belong, but he didn't know who to belong to. He got involved with some of the gang life.
He believed he was buying heroin. He was given 100% fentanyl with a touch of ketamine in it.
We were told after Josh has passed away that they found something on one of the roommates that he was in. It was an opioid. It was a product that actually helps them to stop the urge, I guess.
If fentanyl wouldn't have been around, I truly believe that she would still be here with us.
Colin died alone in a bathroom at a 7-Eleven. How he passed away was due to fentanyl poisoning. What he thought he was buying was heroin. We got the toxicology report back, was pretty much pure fentanyl. The stigma behind overdose addiction is not just some person living on the street sticking a needle in their arm. Colin was a person. not a statistic, not just another addict.
It's another drug dealer. The hell with him. He's nothing. It's like, but he is something. He's my son.
I think I'll always feel some sort of responsibility for Lindsay's death.
I think for the rest of my life, there's just going to be that. There's something missing. It always will be.
This is not easy. I miss him every day.
To this day, it is extremely difficult. I have been diagnosed with broken heart syndrome. I have pains in my chest constantly. The effects will last lifelong.
Parents shouldn't have to bury their kids.
But there are days where you just sit and go, I can't live with this pain anymore. I don't want to be here.
It's just a huge part of my heart just taken out. I miss my son every day.
Deep breath for me, let's go. Come on, sweetheart, let's go. Okay, first dose, 14. That's better, sweetheart. Yeah, she was down in the 80s.
Hi! Hey! What's going on? Just laying down? Well, do you mind sitting up for a second? Yeah, there we go. Nice.
We knew there was a lot of overdoses happening, and it really worried us that there was nobody able to be out there. So we just saw the need, and we just put boots on ground. We pack our backpacks. We walk through the community. We give out safer use supplies, so that's clean needles, pipes, tin foil, that kind of thing. We also give out naloxone. We reverse overdoses. We do basic wound care, snacks, and then just pointing people in the right direction for services, and building a relationship with people, having conversations with people, bringing back some humanity. You know, hearing community members' stories, that's a huge part. Just, yeah, letting them be people and be respected.
We saw an extreme need last summer and thought that using our combined skills, our knowledge and our lived experiences in a way that was mobile and could really meet people where they're at, not just in terms of substance use or houselessness, but also in terms of literally where they're at environmentally.
These people are the ones who really feel that stigma, I think. Boots on ground goes into the places where most people really don't, you know, in the alleys, dumpsters, that kind of thing. People really truly believe that this is an inner city problem, and it's not. It's across the board affecting everybody.
1 minute I can go into the shelter and help someone there, maybe an overdose, and then the next minute I'm going up onto the 12th floor of a penthouse for the same thing.
Addictions don't discriminate. Everybody's vulnerable to that.
Spend a good portion of our day bouncing from overdose call to the next.
In our practice, typically we'll be at a shelter and we'll be dealing with another patient, and an overdose will happen. So often we're like the first on scene, and we're administering naloxone and providing supportive care until EMS arrives.
You want some naloxone? Our teams have a lot of lived experiences that intersect mental health, mental illness, trauma, poverty, substance use. Some of us have family members that have or are currently consuming criminalized drugs. We really believe that it's important to recognize those things as incredibly valuable when you're providing support to community members.
Do you break needles? Yeah, sort of on.
This summer, it was at levels that we've never seen before. The overdose call volume.
We'll get there to say park or somewhere, and there'll be one person that's overdosed. And then when you're dealing with that one, you'll turn around and realize that there's someone else there who's got the same symptoms, because most likely they've used the same batch.
It's really, really important, especially with the toxicity of the street drugs right now, to ensure that people are cared for after the drug poisoning is reversed.
A good portion of our patients, once we've given them Narcan, they tend to be want nothing to do with us. They're up on their way. We're also finding now the opioids are mixed with benzos, so like your Valiums, your midazolam, so it knocks them unconscious, and then so again we've given them the Narcan, and then that doesn't work, and they're still unconscious. So we end up transporting those ones a lot.
The overdoses are becoming more complex, and no two overdoses are alike either.
It's really an all hands on deck situation right now.
Deep breath for me, love. Give her some breaths.
We need so much more help than this system is offering right now.
It's gotten to a point now where it's become fairly disheartening, because we feel like we're just kind of part of this cycle where we're not really helping the problem.
There's a lot of challenge with service delays, both because of the pandemic, so a lot of places are operating at reduced capacity, with decreased services being offered, and we're also seeing that there's just not enough people to support the amount of people that are in need right now.
What is out here now is not working. We need something different.
Do you have anywhere to stay tonight?
Administering naloxone and resuscitating people that are in an overdose and the time and the place is a life-saving effort. But we're just part of this cycle that, we're not really helping the problem, which is the addiction.
To see the lack of services available and the need and the hoops that need to be jumped through is absolutely heartbreaking. And of course, to see the amount of overdoses and deaths that just keep piling up there's no words for it.
It gets overwhelming at a time. I'm seeing 5 to 10 overdoses a day sometimes. But knowing that it could have been something that could have been reversed, or something that could have been not happened, I mean, when your heart gives out on you, there's a few things we can do, but there's only so much.
We've lost so many opportunities to help patients in the community.
Because boots on ground, we shouldn't have to be out here cleaning up the mess. We're just out here because the need is out here. It's really sad to watch. It is. It's really sad to watch. But I'd rather be out here helping.
Customers are supporting us as a business in the community. We should be doing something to strengthen our community, and I feel like doing what we can right now with the overdose crisis is very important. I was kind of one of the first business in the city to bring in naloxone kits to distribute to people, or just to bring awareness that, hey, keep these on site if you're a business. And we held an event here. We did some naloxone training. Each and every was here speaking about it, and Mom Stop Harm were also here speaking. So it's also tried to open up Arcadia as a space for engaging and educating. We support supervised consumption sites because we are one. I assume why bars were created, to get people off the streets and into somewhere, Yeah, it just seems like it's such an easy answer, and it's just frustrating to know that doesn't seem logical to our government.
These policies that are being advocated for by the advocates, which are, safe supplies, supervised consumption sites in every community, drug testing, these are all policies that are in British Columbia and quite frankly, in other jurisdictions on the West Coast, who are all having the highest number of opioid deaths. This is a very complex problem with no one single solution.
It's the drugs you don't think it's in. That's the problem. And the only thing that would stop that is decriminalization and a safe supply. Ability for a group like Boots on Ground to be able to help community members test their drugs would be game-changing for a lot of people, and it would give people the autonomy to use safely and to be aware of what they are consuming. We need more beds, we need more detox spaces, and we need detoxes that accept them from, they say, I need help, I want detox, here's your detox bed. Not come back tomorrow at 10 a.m. and we'll reassess you, come back the next day. If you're dope sick, that's impossible. That's asking a lot. Stop putting up barriers for these people, because that's what's killing them, is all the barriers.
We're really trying to get a true idea of how many people are actually on a waiting list. And then we're also trying to provide consistency throughout the province. This is taking, again, a lot of great work being done by great people all over the province and just trying to coordinate this, right? Which is not an easy task. What we really need to truly measure are outcomes, and that is the system that we're building right now, right? To figure out, you know, how many people have been successful, as an example, right? I think that's very important, right? If we can identify, and this is part of the system that's being built, that, you know, X number of people have entered the system and, you know, they've been able to change their lives around, and then what a great narrative to say that we've, you know, been able to, you know, save X amount of lives. It's ultimately going to be when we get the entire system up and running, and then we can actually start telling people all the success stories that we're having.
Each and every has stepped away from it. The Mom Stop Harm have stepped away from the committee. The NDP have stepped away from the committee. Something needs to be done. I don't know how or when. Maybe the next election. And I mean, when you think of how many people are going to be harmed and sadly pass away, till then, is a very scary thought.
The municipal, provincial, federal governments have to step in. There's no other choice.
When I got into Healing Hearts, this is when I started doing a lot of my investigation on heroin, overdoses, addictions, fentanyl. And when I joined this group, this is where I realized what a pandemic that we are having here in Alberta, especially with overdose. It's just comforting to know that there's other people that feel the same way as you do. You don't feel alone. You don't feel that, oh my God, why am I feeling this? Maybe I shouldn't be, because all these people have felt or feeling the same way.
Being part of Mom Stop the Harm has been a big help. Nobody wants to be part of this, but being involved in Healing Hearts has been a help.
I belong to Healing Hearts. That's like a lifesaver, because they understand, they get what we're going through. Not everybody is like that. There's a lot of stigma out there.
Unless they want to just continually see all these dangerous drugs and all these people dying and all these families suffering, if that's what they want, I don't think anybody wants that.
It's like screaming into the void and nobody listens. It's just continuously begging for help and it falling on deaf ears. It feels like this government is actively trying to kill my child and so many others. And they don't even think twice about it because they don't matter. But they do. They really do matter.
This is not just the deadliest year in Alberta, it's the deadliest year in Canada and the United States and in North America. And, we've created what is known as the recovery-oriented system of care. So, we're doing lots, right? I mean, we set a target of 4,000 spaces, and that is, spaces to make sure that if you want recovery, that you're going to be able to get recovery. We've exceeded that expectation, went from 4,000 to 8,000 spaces.
They just, if we can get them into rehab, well, you can't help a dead person. They're already gone. And to try and get into those places, the waiting list is huge.
We created the virtual opioid dependency program. Basically, it's treatment on demand. You have people and family members, if they're in the throes of addiction, as an example, they only need to call a number, and we can get you on evidence-based medication, like right away. And that's a game changer right there.
Any sort of programs that we have been told are out there for us, they won't accept him because a doctor has decided methadone is the better drug for him over Suboxone, and a lot of these government-funded agencies will only take Suboxone, and that's only a 90-day program. So then what? What happens after that? It's just once one thing is done, there's a huge hurdle, and maybe you'll get to the next thing. Nothing is streamlined. There's no continuity of care, and that's a huge thing.
Governments of the past, I would say, is they want to use boxes, right? And it's like, it's going to take you 30 days to recover, it's going to take you 30 days to recover, or it's going to take you... That's not entirely the case, because everybody is unique in their journey to recovery, right? So some people take a bit longer, some people will take a bit shorter, right? And so the point is that we want to have these continuous spaces that are going 365 days a year, right? Around the clock.
Open up those safe consumption sites again, the death toll has gone, they saved so many.
I have watched this go in a downward spiral very clearly in 2019 when the Kenney government got in. He has opened the doors for private beds to get clean, to open. He has cut funding to mental health supports as well as medical supports for people. He has made it extremely difficult for anyone that does have issues with drugs.
What I do know now, we need safe injection sites. We need something to allow, these people that are taking these drugs to do it in a safe manner, in a safe place, to allow these people to have psychologists, have psychiatrists, have mental health reach out to these people, because I don't think anybody wakes up and says, hey, I want to be a drug user, I want to be a drug addict. That's not the case.
I'd want them to start looking at harm reduction. I'd want them to actually look at speak to actual experts, not a board that they've put together to get the answers they want to hear. Talk to the community. That's who they need to be talking to, not doctors or anybody else. Talk to the people out here. Understand what the actual issue is, and open your mind to other things, because nothing that they are doing right now is working. Nothing.
I hope people understand that this is a very, very complex issue, and I will push back and say it's ideological. I really just want to make sure that people don't die, and I know it's tough. I don't want to see anybody die, quite frankly, but this is just, it's so complex, and we are really trying to do our best to ensure that people have the available resources to them so that when they want help, or families want to get their loved one help, that we have it available for them.
They belong. And when people feel that they don't belong, that's when there's a problem. They belong. They belong to someone. So I hope something can be done. Because I don't want people suffering like we are. It's not fair. There's nothing fair about this at all. Nothing.